Hello, I'm plastic surgeon Mantas Sakalauskas, and today I'm gonna react to TikTok videos about plastic surgery. So let's start from the first one.
Can someone please explain to me what these are? Please, I need to know. Like, why do I have fat abs? Like, why store pockets of fat right in this area? Like, oh no, don't worry, it's not abs, it's literal fat pockets. Literal. Like, why? Please.
Why? We don't have the exact answer, but I would say it's this lady anatomy. What you have in your body, you have. What is your anatomy? It is your anatomy. I think, yeah, she's doing exercises, going to a gym because she's with sportswear. But in some cases, yeah, the ladies, they come to me and they say, yeah, I do a lot of exercises, I am eating healthy food, and I still have these things, these fat pads, or in other parts of the body. In this case, liposuction, I would say it would help.
Explain. And it's so crazy because I used to be very insecure about it, but now I feel like once you enter your 30s, or maybe when you become a mom, you just have like a different appreciation for your body.
And she is after the baby, as I understood. So after the pregnancy, also the hormones in body, they change. Sometimes they don't go back in general entirely as we were before the pregnancy. So this happens also for a lot of ladies who had children.
Body as a woman, so I'm good now. I'm not insecure about it. I'm just like, why? Like, oh no, don't worry. It's not abs. It's just fat abs.
So yeah, it will not disappear by itself if sports or diet don't help. So I would say plastic surgery in this case, it can help.
I'm calling it hooded eyes are going to be the new coveted thing in aesthetics, and people are going to get fat transfers to their upper eyelids. We've seen this massive shift towards everybody.
I don't think so that she's right entirely, but about one thing she's right. Now we are doing fat transfer to the upper eyelids when the eyes were very deep. There is no fat pads in the upper eyelids, and the look, it's tired, the eyes are tired, it's not youthful. So yeah, in some cases with upper blepharoplasty I also do fat transfer, but to make the eyes hooded, it's the question.
Everybody is surgically altering their eye shape to look the same. Blepharoplasties are huge, brow lifts are huge, and they can have beautiful results, but they're not right for everybody, and yet everybody is getting them. And on a lot of people, I think...
Now she's right also about something. But yeah, not for everybody. We need to lift the eyebrows as much as it's possible. In my experience, I don't like to do the eyebrows too high. What I'm doing more, it's like lifting of a lateral aspect of the eyebrow. When the eye is more open in the lateral aspect, and it gives you more youthful but not surprised look. Because I know some surgeons, yeah, we do all the eyebrow lift, and for me, these patients, they also look awkward and they are all surprised. I don't think so. It's aesthetically a good view.
And on a lot of people, I think this detracts from what is beautiful and unique about them. An example that sticks out to me is Olivia Munn, and I don't mean to call anybody out in
Olivia Munn. Let's try to look who she is, or remember who she is. Now I see about what she's talking.
In particular, because this is rampant among celebrities and normal people, and there's a much bigger conversation to be had about double eyelid surgery, particularly among Asian women. But she just stands out to me as having had this really striking, beautiful look. And she's still beautiful, of course, but she just lost an element of what made her striking.
In my opinion, she looks better after the eyelid surgery, but you see, the concept of beauty, what we understand, it's entirely different person to person. So maybe, yeah, for this lady, she was prettier before. For me now, her eyes look better after the upper eyelid surgery.
And she looks a lot more like everybody else now. And I think the general public will start to see that this...
And I don't think so that when you do the upper eyelid surgery, you make the patients similar to each other. In all cases, we don't have identical eyes. Open eyes yes, it's more youthful.
I think brows are gonna get lower, eyes are gonna look heavier and sleepier, which is sexy.
Maybe this will happen after 1,000 years, I don't know. But I don't think so that in 100 years it would go like that heavier eyes would be nicer than open eyes. Maybe for men, not very open eye, it's more sexy, but not for women, I think. The big reason also we do the blepharoplasty, it's not only for aesthetical purpose. In most cases, there is a lot of excess of the skin in the upper eyelid and it covers the eyelashes. Let's go for another one.
Did you know you can have breast augmentation done without going to sleep for surgery? This means you'll have the implants placed under something called local anesthesia.
Yes, you can have local, but entirely under local, I didn't hear that. But intravenous anesthesia, yeah, you can have, but if it is uncomfortable, if it is comfortable for the patient, I don't think so. If it is comfortable for the surgeon, I don't think so. Maybe, yeah, you can spend a little bit less money for the surgery with local anesthesia, but if it is safe, it's questionable, because under local anesthesia also, maybe, yeah, let's hear a little bit more, but
During local anesthesia, we use a small amount of numbing medication to make sure that you don't feel any discomfort during surgery. Believe it or not, patients who choose this option say that they can't imagine having it done any other way. For women seeking options with minimal downtime, choosing to have breast augmentation done under local anesthesia with implants placed above the muscle.
So yes, this is the question. Above the muscle, maybe yeah, it's possible if you infiltrate a lot of local anesthetic, that it's also not very safe because it can be reaction after that, an anaphylactic reaction. But in this case, yeah, it's possible to do that. But half under the muscle, it's not possible because we need that the pectoral muscle would be relaxed. In local anesthesia, we cannot achieve that. So in this case, maybe it's possible, but above the muscle, you can put the implant in very small amount of the cases, in my opinion, because the patients, we need to have some tissue in the breast. In most cases, if the ladies come for a breast augmentation, their breast, they are biggest maybe to B cup, so in general there is no big amount of the tissue and it will not cover implant nicely. And after that, what will be fake look? What can be, the rippling can be visible and the upper pole of the breast, it will look very natural.
Muscle is one of the options that has the speediest recovery times and the quickest return to everyday life.
This is true, but after local anesthesia, you can return to your everyday life faster. What the results? It's very interesting to see maybe results of the surgeon, which ones are made in local anesthesia. This is interesting to see for me. Thanks for watching. If you want more, just ask. Bye.